Doctor, to you first. Do you believe that the president can safely go from being hospitalized to holding a gigantic rally in the course of 1 week?
Well, Stephanie, the problem is we really don't know. There hasn't been enough information out there. The recommendations are that it should be 10 days since the onset of an infection, but you have to know whether somebody's on symptom relieving medications and whether they have symptoms when they're off those medications. In addition, we do know that there are many cases actually that go beyond 10 days where they're infectious. So we're going to need to have that testing. But Stephanie, I'm more worried not about the president, but I'm more worried about him putting people at risk in these rallies. We know that his rallies consist of people who don't social distance, who don't wear masks. And you would think after going through the experience that we've just had at the White House, showing how infectious this virus is and how this pandemic is not yet under control, that we would not be bringing people together under mass gatherings in these situations, but we're going to go right back to the old behavior. And that's just really disheartening.
It's not the old behavior. It's the current behavior. Last night, Don Jr. hosted an event indoors in Florida, mostly maskless. It's not going back. They're still there. But let's share what we do know, Doctor, because Dr. Connolly put out a memo that said the president is, quote, devoid of any indications to suggest progression of illness. And based on the trajectory of advanced diagnosis the team has been conducting, I fully anticipate the president's safe return to public engagements by Saturday. All right, that's great. But you know what that statement doesn't say? That President Trump tested negative for coronavirus. Wouldn't that make it plain and clear and get people a whole lot more comfortable?
I think you're absolutely right. And there's a mystery around why this medical team, has not been more transparent with the testing data. I think that we've seen many people being put at risk because they were not appropriately contact traced, because we don't know when the last time the president had tested negative. And now again, with the president about to go out on the trail again, we're not having transparency about something that could be very easily resolved. And in addition, I think that we've already seen that, unfortunately, we have medical professionals and even public health professionals who are being influenced by the president's political desires. And that simply erodes the confidence that the public has in our health professionals. And we can't afford that during a time of a pandemic.
All right, Miguel, help me out. Math is hard for me. President Trump says he will not do a virtual debate, so he's doing a rally instead. Here's the problem. A rally gets like 3 million viewers instead of the 60 million you could get from a debate. Plus, the president already has his base. My question is pounding his base over and over enough to get him to 270 electoral votes?
No, it's not. And so there are two campaigns underway right now. There is the campaign that Donald Trump is running, and there's the campaign that his campaign is actually trying to run. And the problem is Donald Trump wants to do the very thing that does not necessarily, given where he is in the polls, expand his opportunity to meet a wider spectrum of voters. He needs to not only hold the line that got him elected in 2016, but he's got to now, in this new environment because of COVID, the flatlining of the economy and the civil unrest, he's got to figure out where he can go if those lines begin to break. And the way you do that is using mediums that afford you the greatest opportunity to speak to the most people. Look, Donald Trump eschewed any opportunity America could have for sympathy for him. He's treated this as if it's like that, knowing that a lot of Americans have suffered and died because of this. So he's created this separation in the narrative between himself and the American people, which is what his actual campaign has been trying to close. So this decision, just very quickly dismiss the virtual debate where, 60, 70 million people are going to be watching you, throws his campaign backwards. So with less than 25 days left in this campaign, where do you go? Donald Trump thinks he goes to a rally with 1,000, 10,000 people in Florida, still filled with COVID-19, because I'm not buying anything Dr. Connolly's selling. I'm sorry. I'm just not. You know, everybody else can sit there and be all, oh, yeah, well, he must be getting better. No, he's not. The man is full of COVID-19.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.